Dr. Leisle, you talked about how parents are supposed to help their children brushing their teeth up till about, 6, 7, sometimes even slightly longer, simply because they're not quite able to do it themselves, even if they want it. Now, what about the parent who faces a nice, beautiful, strong-headed, slightly stubborn child who says, no, I'll do it?
We see those on a regular basis.
You do?
Half the practice is 55% of the practice is 3 years of age and under. So we see lots of those 2-year-olds that say no, because they've heard it so much. Yeah, that is the parents that have a strong-willed child, what I would call a strong-willed child, or the child is very independent, says, I want to do it my way, which a lot of American kids do. The parent has to take, you might say, the bull by the horns and do what needs to be done, whether the child wants to do it or not. Obviously, the best way is to make it fun. You sing to them while you're brushing their teeth. You make it, tell them a story. Do something that's entertaining while they're doing it. But the bottom line is it has to get done. And the more often you do it, that is the key. That's the first key, is building a habit with a child right from the beginning. If you know, very early that the first few months you have a strong-willed child, boy, you want to start getting in their mouth before they get teeth with a washcloth. If you don't realize it until after they have their teeth, they're strong-willed, and you'll see it pretty quick. Out of my 6 kids, I have a couple of them. Anyway, so take after Dad. Anyway,
so basically, like I think I heard you saying that mom should start, being it with a cloth or something. You should start cleaning the teeth right from the get-go anyway, even maybe before when they're just teething and when they just have the gums. So if you do that, then probably, because you don't know how your child, so to say, how headstrong he or she becomes in a year, 2 or 3. So, but if you start there, then it's part of the routine. Mommy has her hands in my mouth, and that's just part of it.
You will know, for us parents that have a 2-year-old or 1-year-old, within that first year or so, your child, whether they're compliant or on the other side, defiant, okay? And so the situation is that, yes, before they have teeth, a washcloth. After they have teeth, a toothbrush. And the more consistent we are in brushing, the less resistive they'll become, because it becomes a habit. Just like, eating, sleeping, all those things, building the habits in the child that are good habits. Anyway, so brushing from behind the child. Come from behind the child, brushing, so they can look in you in the mirror and you're looking at them and you can see what you're doing. Very good idea, rather than being in front. So once again, the whole mindset of it is making sure that you are brushing for them and they understand that this is something we're going to do.
Okay. Well, all right. Wonderful. And I guess what you're saying is if it comes to a showdown, you just got to win that showdown.
Yeah, and then there's ways of doing it. Let's say then that just isn't working. And that child's going to resist you, move around, head side to side, and crying, whining, whatever. Then you might have to sit on the floor with a child, and you put your calves over their legs, and your thighs over their arms, and their head is right there. That's the extreme. And then you say, we're going to get this done. And you smile. You don't threaten about it. You just go and do it. And a child will size it up. A strong-willed child sizes that real quick. It's a lot easier when mom and dad don't pin me down to brush my teeth. They get that point real quick. Our children size us up so fast. That's what I love about kids. They don't play games. They size you up.
Well, that's why children know when they're in a restaurant and they want a Coca-Cola and they don't get it, just, turn up the volume a little bit, and mom doesn't want to be embarrassed from the waiter and the rest of the people sitting, and here comes the Coca-Cola.
Yeah.
And if
we take a trip to the bathroom to have a little talk.
Okay. All right. So basically, I'm sure different parents have different ways of getting things done no matter what.
Exactly.
The idea is get it done.
That's right.
Thank you very much, Dr. Leisle.
You're very welcome.